you. African American women are 3 times more likely to die from pregnancy-related complications than white women. This Black Maternal Health Week is a good time to highlight why experts say many of these outcomes are preventable. And joining us now is Dr. Shanaeya Nelson. She is the Chief OB/GYN at Kaiser Permanente South Bay Medical Center. Such an important topic. Thank you for coming in to talk to us about it.
It's my pleasure.
So 80% of pregnancy-related deaths are preventable. That's an astonishing number. What are some of the root causes affecting Black maternal health in California and more broadly across the nation?
Some of the causes are disparities in race and ethnicity, chronic medical conditions, socioeconomic factors that affect access to prenatal and postpartum care, and the quality of care given. Pre-existing conditions such as high blood pressure, diabetes, and obesity are more prevalent in the Black community. And these conditions increase the risk of complications. Additionally, varying quality of care, such as hospital practices and provider training, also increases disparities in maternal outcomes.
And that's the really interesting part, I think, to me, and distressing part, right? So can you explain the implicit biases and these other practices you've been talking about when Black women go to get health care?
Yes. Implicit bias is the unconscious attitudes and stereotypes that affect how we think, feel, and act towards others. And we often have no idea that we even have these biases. Healthcare professionals can have unconscious biases that affect their clinical decision-making. Implicit bias also affects unequal treatment and medical outcomes in patients of color. In addition, biases in general affect policies, practices, and resource allocation, which then increases disparities in treatment, access, and overall health outcomes in the Black community.
It's a cycle.
It is, unfortunately.
So what should Black women be asking their doctors if they perceive this bias, if they don't think that they're getting the right care, if their doctor's not listening to them or their healthcare provider? What kinds of questions should they be asking when they're pregnant and having complications?
And that is important. Black women, we need to be heard. Our voices need to be acknowledged, and our concerns need to be evaluated. So when you see your doctor, talk to them. Explain your fears, your thoughts, your worries. Have communication back and forth so they know what you're thinking and what you're worried about.
What are some of the warning signs that might sometimes be overlooked? We know, the very basic ones during pregnancy, but what should women be looking out for?
Yeah, so early recognition of warning signs is very important. So things like severe headache, extreme swelling, difficulty breathing, abnormal vital signs, severe unrelieved pain, those are very important warning signs to look out for.
And what should the rest of us be doing to advocate for Black women in health?
Yes, so enacting policies and initiatives that improve resources are very important. Additional resources will help improve the quality of care and improve patient access to get the care. So advocacy is very, very important.
What are women coming to you and telling you about their experiences? I mean, I'm sure you've heard from them personally about some of these issues.
Yes, so there's a mix. There's some patients that come in very, very worried, and I alleviate their concerns. It's important as a healthcare professional to treat each patient how you'd want to be treated. So letting them know that you have their back, you care for them, you want the best outcome possible for them and their baby. The goal is for every mother to have a healthy baby and every baby to go home with their mother.
And so what do they tell you their experience has been like in terms of the bias, in terms of not having equal access, and in terms of just the troubles they've run into in the system?
Yes. Well, thankfully at Kaiser Permanente, we try our very, very best to provide excellent quality patient care and give each patient the care that they should have. But some patients have had unfortunate situations where they have had poor care and they come in with a fear that's going to happen to them as well.
All right, well, Dr. Nelson, thank you. It's really important to highlight this going forward, and I'm sure you do alleviate their fears. I can tell you take great care of your patients.
Thank you. I try my very best. Thank you so much.
Thank you. All right, Jamie, back to you.
Rudabeh, thank you.